South Africa's daily positivity rate jumped slightly. SAPA recommends government lift pause on the J&J vaccine rollout, and COVID-19 vaccine registration open for over 60s. These are the top coronavirus headlines from this week. We at African News Agency have been tracking the critical moments for you, and we wrapped it up in 3 minutes. After remaining consistently below 5% for the past 3 weeks, South Africa's daily test positivity rate has jumped to over 9%. The big COVID-19 third wave, which had been predicted to hit the country in the weeks after the long Easter weekend, has not yet materialized. But scientists are picking up on a slight uptick in the number of new infections. Dr. Ridwan Suleiman from the Council for Scientific and Industrial Research said it would take around 10 to 14 days to determine whether Easter gatherings would increase case numbers. He said there are some clear signs that an Easter wave could be driven by a resurgence in 3 of the smaller provinces, namely the Northern Cape, the Free State, and the Northwest. Professor Tulio de Oliveira, the director for the KwaZulu-Natal Research, Innovation and Sequencing Platform, said South Africa needs to increase some of the public health responses, which includes testing, contact tracing, quarantine, and isolation. SAPRA has recommended that government lift the pause on administering Johnson & Johnson's COVID-19 vaccines to healthcare workers. Last week, the FDA recommended a pause on the issuing of the vaccine over potentially dangerous blood clotting concerns. Health Minister William Keagan announced on the same day that the rollout part of the Sisonke implementation study would be temporarily suspended. 6 women in the United States developed a rare blood clotting disorder after getting the vaccine. 1 case was fatal and 1 remains in critical care. SAPRA said that it had been reviewing data from the Johnson & Johnson's local research study and found no major safety concerns. South African citizens who would like to receive a COVID-19 vaccine and are over the age of 60 are able to register through the electronic vaccination data system. Registrations opened on Friday, however, the vaccines will only be rolled out in 2 phases, on the 17th of May and on the 17th of October. With self-registration, individuals would have to log into a web portal and register themselves. Those who are unable to self-register could visit walk-in centers and vaccination sites. To register, people need to have access to the internet, their ID number or passport, and general contact information, including a cell phone number. If you are unable to register by these methods, you may go to the nearest vaccination center and you will be registered on the spot. That's 3 minutes. Tune in next week for another roundup of the top coronavirus stories.